Takayasu's arteritis. This is today's disease of the day. The aorta, very important major vessel that surrounds the heart, provides oxygenated blood to the rest of the body through the left ventricle. In Takayasu's arteritis, we have a chronic inflammatory response which attacks the aorta. As a result, the aorta gets damaged and starts to become weaker. So we also call this disease aortic heart syndrome. Patients who would typically get Takayasu's arteritis are in Southeast Asia, with the highest prevalence in Japan and specifically in women. Signs and symptoms. We are worried about patients with Takayasu's arteritis if they present primarily with three things. We're worried about if they have weight loss, if they have night sweats, if they have malaise. So very similar with cancer, but along with these three, we're also looking for limb claudication, visual disturbances, and pulselessness. This is a key characteristic of Takayasu's arteritis. We also know that patients who have had temporal arteritis are also more at risk of having Takayasu's arteritis. We can start actually clinically diagnosing them. So what we can do is get an FBC, which has a CSR and CRP and ESR with it as well. Both would be raised. On top of that, for imaging, we can consider a chest X-ray, which provides a mediastinal widening. And then for confirmatory imaging, we can do what's called an MRI angiography or an MRA. Treatment for Takayasu's arteritis would be oral prednisolone, 1 milligram per kilogram per day, as well as aspirin 75 milligrams a day. Assuming these two do not work, we would move on to immunosuppressive medication, such as azathioprine or methotrexate.